Welcome back to another video Q&A. It's been a while since I made a video. It's been a very crazy summer. Unfortunately, we had a death in the family and we had a lot of changes in our organization and in our team members. It's all good. You can see Felix. You might see some of my cats jumping on and walking around. So, try to focus. So again, this video is all about the questions that I get every single day from all of you guys. And as far as the dentistry is concerned, a lot of people are very private about their dental health and oral health. So, and they're watching the videos, but they're so embarrassed and shy to send out any questions. So I get to talk to all of you guys in the practice, in our dental clinic, that I collect all different kind of questions, which keeps me on my feet. So today's first question, why my teeth are yellow? And I have touched upon this subject in one of my YouTube video, the Pop series, as far as the different shades that the teeth come in with. So the shade of the teeth is the reflection of the shade of the dentin. The dentin is the inner layer of the tooth. So you have enamel, then you have a dentin, and then you have the pulp. So if you take a cross section of the tooth, you'll see that. You see a nice thick white enamel layer, and then you have the softer inside layer, which is the dentin. And then the dentin actually sits on top of the nerve chamber or the pulp chamber. So the majority of people have the yellow undertone. Yellow undertone, that's the shade of the dentin. Come here, Bruno. And if the darker the dentin is, the darker the enamel will reflect on the enamel layer. But also you have the brown shade and you have also the gray shade. And the gray shade, like I mentioned in my other video, is the effect of the tetracycline stain. When they used to give, you don't see it in the new generation, it's more like older generation. So my generation or older, they used to give pregnant moms tetracycline for flu or fevers. And that, for some reason, we don't know why only tetracycline, it will affect the dentin, which is the layer under the enamel, and it will give it that gray hue or the gray color. So why your teeth are yellow? Again, it's just natural shade of the dentin, which is the underlying layer, but also it will reflect, obviously, if the enamel is stained or the enamel is getting thin or getting chalky, and that catches on stain. So it could be superficial stain on the enamel, which is really easy. If you can bleach or you can whiten, and that will bleach in the dentin. Also, if the dentin is super yellow, the bleach can go in. It will go in, and then it will bleach the dentin a little bit. That's why some of us have sensitivity, and that brilliant white shade will reflect on the enamel, and the enamel will be brighter. So it could be food, acidity, smoking, chip in the enamel that catches on, stain a lot, or the coloration of the food. A lot of our food has a lot of artificial flavors. Don't get me started on that. And those chemicals, nobody tests on teeth. Nobody, no company or R&D puts a lot of effort testing on what would be the effect of enamel from these preservatives or from these the colorings that we put in. Even as simple as I have patients coming in and they're saying that, oh, my teeth are sensitive to sweet. So sweet sensitivity is directly related to active decay. But many of those patients don't have active decay, but they're very, very sensitive to sweet. My observational data and my conclusion or my brain or my 23 years of dental experience tells me that it's the preservatives and it's the coloring, it's the artificial sweetener that actually tingles through and will have the effect of the sweet sensitivity. But if there is no decay and there's no open access for the sugar to go in, and causes decay, and the decay responding to the sugar, so where the sensitivity is coming from, it doesn't make any sense. The only thing, like I said, I can think of, that's what my brain is telling me, is it could be the chemicals in there, because a lot of us that has a reaction, for example, to Novocaine, it's not the epi, because our body makes epinephrine. It's the reaction and sensitivity to the preservatives that's in the Novocaine. I hope that answered the questions. If you have any more questions, please put it in the comment and I will elaborate on that. Why do I keep biting my cheeks? That's a very, very good question. Biting the inside of the cheek, it's contributed to many different things. One of them is the habit of clenching and grinding. So we are supposed to use our jaw for just clenching the teeth together, mincing and breaking the food. If we are just clenching and grinding, or doing that kind of side way clenching and grinding, you find yourself catching the inside of your cheek. That's one reason. The other reason is there is a salivary gland duct that's inside the cheek, and some of you has very prominent anatomy of that duct, and you will catch it. It's basically parallel to the upper teeth inside the cheek. And those ducts work like a irrigation system that actually irrigates the mouth and serves the moisturizing and lubricating of the upper teeth. And then we have a duct under the tongue, and that will serve the lower teeth. If that anatomy is very prominent, or that anatomy is, especially if you bite it once and it swells up and gets inflamed, you're going to catch it again as you sway your jaw with clenching and grinding, catching that skin tag that we call it looks like a skin tag if you pull your cheek away, and that actually the orifice of the duct sticking out. And that's one of the reason, again, it's prominent salivary duct. It could be you clenching and grinding. And also if you have a crossbite means the reverse bite of the favorable bite, which is basically, the top teeth supposed to cover the bottom teeth. If you have the bottom teeth covering the top teeth, and guess what? This tooth right here is going to constantly catch on your cheek. So, but those are some of the reasons, or the main reasons, that you will catch your cheek every time. And obviously, if the duct is swollen and you create that scar tissue or tag, you're going to constantly catch it with your clenching and grinding. I never seen anybody that will require. So what do we do with that? That's another good question. What do we do with a swollen scar tissue? Some of you will build scar tissue and that will just stay there. If you pull your cheek, you see like white lines against the cheek, and that's just scar tissue from biting your cheek. The one thing is wearing a night guard, obviously, because of clenching and grinding. The other thing is we ask you guys not to do a lot of the ice, crunching the ice or chewing on ice or chewing on almonds, because the moment you wedge that between the teeth, you will push the jaw to sway in a wrong way, and will catch the actual cheek. So wearing a night guard, if you have a retainer, make sure you wear a retainer every single night. Try to avoid like I said, the almonds, the ice chewing. I have patients that chew on pencils all day, so please stop. That will definitely, irritate the area. We don't really treat prominent, scars in the cheek for cheek biting. We just try to educate the patient and try to eliminate any of the habits that will cause that trauma to the cheek. Because remember, if the trauma continues to the cheek, you are gonna traumatize the salivary duct too. And before you know it, we have a condition that we created, and we have to, deal with it. And what we do with that, we send you to an oral surgeon. The oral surgeon have to check the salivary duct, and if they cannot If they cannot fix it, then they'll send you to, you know, an ENT, or they'll send you to your medical examiner to evaluate the area. There's really not much we can do, but by reducing the habits, you will, the area will heal. You can put vitamin E on it. You can rinse with warm water and salt. Don't put oral gel on it. It's just not going to do you any good or any justice. But that's it for now. I hope I catch you in the next video, and I'll see you guys soon.